to thank all my viewers for your constant love and for supporting me. Okay, today we were here for the second topic, that is our autonomic dysreflexia. So it's a new topic. So let's see what is this autonomic dysreflexia. Autonomic is related to the autonomic nervous system, which control the involuntary system of our body. Okay. So autonomic, let's see what is this. Autonomic dysreflexia is an abnormal overreaction of the involuntary, that is your autonomic nervous system, to stimulation. And this reaction may include the change in the heart rate, excessive sweating will be there, high blood pressure will be there. So autonomic dysreflexia, we can say, is a serious medical problem that can happen if you have injured your spinal cord in your upper back. Let's see. Okay, what is it? Autonomic dysreflexia also is known as autonomic hyperreflexia. So autonomic dysreflexia commonly is caused by the visceral distention from a distended bladder or an impacted rectum. Okay, it is very important. What will be there? Distended bladder and the impacted rectum will be there. So autonomic dysreflexia is a neurological emergency and must be treated immediately to prevent a hypertensive stroke. As I told, as a reaction, what will be there? High blood pressure will be there. Because of that, hypertensive stroke may occur. Okay, then the autonomic dysreflexia generally occurs after the period of spinal shock reveal. What will happen in the autonomic dysreflexia generally occurs with the lesions or injuries above the T6, that means your thoracic 6 of the spinal cord, and in a cervical lesions. Okay, let's see. See this, the spinal cord. What this T6 is affected. See, so the triggered this disease may autonomic dysreflexia, or we can say spinal cord injury at the T6 or higher. So the triggered by the sustained stimuli at T6. Okay, how next we will do? How we will do the assessment of this disease? What will happen? Hypertension will be there. That means high blood pressure. Then bradycardia, slow heart rate, flushing of the face and the neck, flushed face will be there. Patient may complain of severe throbbing headache, nasal stuffiness will be there, piloerection, that means goose flesh will be there, sweating. Patient may complain of high increased sweating, and the patient may complain of nausea and vomiting. Restlessness will be there, and the dilated pupils, and patient may complain of blurred vision. Okay, so here you can see patient may have pressure areas, full bladder will be there, distended bladder will be there. Because of that, patient may have UTI and fecal impaction will be there. This is the main assessment criteria for this disease. And what is the intervention? What you have to do? You have to notify the physician if the signs of autonomic dysreflexia occur, assess for the potential cause and remove the stimulus. Raise the head of the bed to high fowler's position. Loosen the tight clothings. You have to monitor for the vital signs, particularly the blood pressure, because patient may have high blood pressure. So you have to be very vigilant, and you have to monitor the vital signs every 15 minutes. Okay. Assess for the bladder distention. The full bladder will be there, so you have to prepare for the urinary catheterization. If the urinary catheter is already present, what you have to do? You have to check for the kinks in the tubing and for the drainage. Last is assess for the fecal impaction, because fecal impaction will be there. What you have to do? You have to disimpact it immediately. Okay. So this is all about the interventions of this autonomic dysreflexia. Hope this small topic is clear to you all. Thank you.